Hi everyone, Jenica here again with Live Your Best. I'm here to bring you another video on a product review, and this is for fish oil in general. Not a specific fish oil, but this is just fish oil in general. And I have some specific reasons for bringing this one up. What started this for me was when I was doing my internship at the Utah State Prison, and this was the year of 2012. I noticed, and I usually worked with the women, mostly with the women, some with the men. I had a population, I was around of about 1,000 to 1,200 people, and most of those were women. And I noticed this pattern as I was there, that the medical doctors that were over the entire prison population would prescribe fish oil for a lot of people's depression. And this was because a lot of the women in there with some kind of addiction, so doctors didn't want to get into, are you really depressed or are you not? Well, let's really find out. Here's some fish oil. But fish oil nobody wants to cheek, as in store in your cheek to use later to trade for internal goods and services. So, and they did this a lot. And some of the women said it worked really good. Others are like, not really. It's whatever. If I can't have my normal prescription, then this is whatever. I'm okay. So that got me really thinking about, and these were doctors, medical doctors, MDs, that were doing this. So I started asking some questions kind of to myself, and brought it up with my supervisor and some professors at the time. But that kind of got me on the path with what is up with fish oil. And then I started, as the years went by, I'd always heard the big three things I had heard about fish oil were it's good for depression, brain health, and heart health. Those are kind of vague, except for depression. But yeah, those are vague. So I wanted to research this, and I take it also, and I'll get into that and why and what it does for me. And I've been taking it for years and years. So now with all the research I found a lot of mixed results. Some studies were very conclusive in this. Yes, we did find improvements in X, Y, and Z symptoms and X, Y, and Z diseases. Others were like, yeah, kind of, it's inconclusive, kind of weak. We need more research. A lot of researchers will say we need more research, which is usually the case. And then some did say, yeah, we didn't find anything conclusive. This is whatever. This is garbage. So now, with all the positive research I did find, I can definitely see why there are entities out there, people or groups or organizations who want to say that fish oil is useless. Totally. And this was interesting. I found one of the first articles I found, actually, the FDA approved a fish oil prescription for heart disease. And within fish oil, there are three main omega-3 fatty acid components. There's EPA, DHA, and AA. They're long, crazy names. You can go look them up. EPA, DHA, and AA, okay? And the prescription that they approved, I don't know, I think it was EPA only, but I'm not sure. Now for the FDA, the Food and Drug Administration, they basically control everything that we put in our bodies or have available to us readily in the stores and by prescription to put in our bodies. For them to do their own trials and admit that anything natural is for real and efficacious, as we call it, as an effective in what it claims to be effective for, is very rare. Very, very rare. So there's definitely something to it. So here I found some more claims. Make sure my cat's not getting into anything. Okay, we're good. She's just snooping around. So some more found claims besides depression, heart health, and brain health. I also found some claims. Again, these are claims of how it helps: rheumatoid arthritis, osteoarthritis, anxiety, bipolar disorder, schizophrenia, and ADHD. And I used to work with psychotic disorders quite a lot in my career. So the schizophrenia one was very, very interesting to me. I've never heard that. So I researched it. So we'll start with depression, because this is the absolute most common mental health disorder in the world, I think. So the research was overwhelming in this. There are a few studies I found that said, yeah, we don't really think fish oil does anything for depression, but most of them concluded and agreed that fish oil is a fantastic, what is called tandem treatment for depression, as in it's a great, or secondary, it's a great treatment to go along with someone who is already being prescribed an antidepressant. And there were a couple of trials I could find where people with milder depression found decreasing of their depressive symptoms with just fish oil. So, and of course, all of this needs more research, period. And I am going to be looking at notes because, again, there was just too much for me to try to remember. Article, I thought this was fantastic. Article reviewing several studies concluded that fish oil is good for people who have heart disease and depression, because depression is very, very commonly comorbid, as in exists with heart disease. So that's a fantastic find. Also, Dr. Barry Sears, he's an author for the American Chiropractor Journal, also a former researcher from Boston University and MIT, so he knows what he's talking about. He made really good points about the consumption of fish, which is where fish oil comes from, and depression. So he said, yeah, on the first go-round, you see that populations who eat a lot of fish have almost no depression, and populations who eat very little fish have a lot of depression. And he said this isn't necessarily cause and effect. He said there can be things going on like genetic predispositions, something we call cultural protective factors, means things you do in your culture that generally make you happy. Like, I know a big protective factor for the Scandinavian countries is like skiing and sledding and snowboarding and ice skating in the winter time, in the winter months. That really helps people get through the winters up there because they're long and dark, right? So, those are just some examples. So, he made some good points on both ends. So, and then several other articles supported that, fish oil is just good overall for decreasing symptoms of depression. Now for heart disease. This was insane, the amount of research I found that supports that fish oil is really good for, as a cardioprotective factor is what they called it, protecting your heart and your cardiovascular system from disease. What that means on a molecular level, I don't know. Sorry. I'm not a scientist yet, I guess. So I want to highlight what they found. This is from the American Heart Association, and this was very interesting. Wanted to bring this up because, again, they're going to be very focused on Western medicine, not fish oil, not naturally derived substances. So they found that coronary heart disease, which is a cardiovascular disease, okay, the random control trials that they did cite were a little bit inconsistent, but the authors of studies did have positive things to say. Most of them made a recommendation that fish oil is a reasonable supplement, and I think they're using the word reasonable to be kind of safe, which is fine. We're talking about heart disease here. That's huge. Also in coronary heart disease, suggested a benefit of fish oil supplementation, specifically in the reduction in cardiovascular disease hard endpoints. Like, what does this mean in the end? It's like, great if you feel good, but what does this mean in the end? So meaning their hard endpoints were cardiovascular death, non-fatal heart attack, non-fatal stroke, but mostly in reduction of sudden cardiac death. Yeah, again, another one they cited may reduce coronary heart disease death. And this is risk, okay? So risk, and of course that does help decrease instances. So that's really freaking cool. I thought that was incredible. So there's also loads of research supporting fish oils lower bad cholesterol. That's everywhere. Also found a very good peer-reviewed article, again, an article that looks at research, puts it together, say, here, this is what we found. that omega-3s, which are the fatty acids in fish oil, reduce the presence of these little things called adhesion molecules, which makes cholesterol stick together in the arteries and cause what we've heard of as plaque, which blocks your arteries, blocks the blood flow within your arteries and veins. So it helps reduce the presence of these things. And one article said it reduced it by, it was either between 25 and 28%. So good stuff. For the different types of arthritis, rheumatoid and osteoarthritis, evidence is fair at best in treatment for both types of arthritis. There just really aren't that many conclusive studies out there, but some people use it and swear by it. And some said that fish oil can help alleviate the pain from these because fish oil has tremendous anti-inflammatory properties. So that's really, really great. And others said it somewhat decreases the risk in developing arthritis in the first place. So maybe more of a protective thing, but more research is needed, yes. Now for anxiety, I did find a study found that fish oil decreases anxiety symptoms in medical students at Ohio State. So basically what happened is someone wanted to do some research at the Ohio State University, and they used the medical students, and maybe one of the medical students did it. And it's an easy population to get. You're at school because everyone's like, yeah, totally. Education, let's, let's forward the cause of education. So that's cool. But they did find a significant decrease in anxiety symptoms. And kind of an interesting thing is, the medical students, yeah, I think they would naturally be just predisposed to anxiety because of their being medical students. So that might suggest some help with younger populations. And maybe student populations too. They also did mention they weren't diagnosed with, say, generalized anxiety disorder. They just had anxiety symptoms. Okay, and on the anxiety idea, another study I found said that fish oil worked better with people who had a diagnosis of anxiety disorder versus those who didn't. Okay. And it was better for people who had higher doses of fish oil given to them versus low doses, and what their cutoff was 2,000 milligrams or more of fish oil, and then the less they took, less effective it was. For schizophrenia, there was actually some really conclusive research in this, and I was not expecting it. I thought it was going to be just another sad, hopeful, hope smash kind of thing, because schizophrenia is very difficult to treat. A lot of research said that fish oil can help alleviate some symptoms, certain symptoms of schizophrenia. It never got rid of it, just alleviated, palliated it, basically lessened the severity. And that's pretty much what fish oil is doing with all of these diseases and disorders. And I did find a very cool article from PubMed Central, which is the free section of PubMed, that spoke about the effectiveness of omega-3s in the dopamine pathways in the brain. Dopamine does a lot of wonderful things to our brain to keep us normal. And that is one of the neurotransmitters that allegedly causes a lot of the symptoms of schizophrenia, and allegedly also other things like ADHD, depression, anxiety, bipolar, that it has a big role in a lot of different mental health issues. Also Parkinson's, they mentioned in here that the dopamine pathways are dysregulated in all of these disorders: depression, anxiety, Parkinson's, ADHD, and to a degree depression. Depression, and there's more going on, but dopamine is a very big player. Okay. They said, and within these researches, they said that it's not indicated as a standalone treatment, but it could definitely be beneficial as a secondary treatment. Again, tandem, going with, Thorazine if they're on that. Hopefully not, for God's sake. But, here's my primary big pharma one, secondary fish oil. And it can act as a preventative measure for mental health disorders. And then as far as ADHD, same, fish oil works on the dopamine pathway problems in ADHD, thus supposedly help alleviating symptoms. And that, again, didn't find too much research on that, but what I did find was good, but definitely needs more research. And just as with this and anything on the market, more research is always needed. What the hardest thing is to do in research is to conduct longitudinal studies, which means long term, which means we're waiting around forever to see how fish oil works, or CBD oil, or lavender, or whatever. Yeah, these are very hard to do because it's the element of time. You have to wait to see what happens in real time. So there are people out there doing those things, I am sure. So we'll have them one day. But there's a lot of really good research on fish oil. Now, because I happen to take fish oil too, and I freaking love it. So I will tell you pre-baby and post-baby, because my son just turned 2, and my brain has not recovered completely at all. So pre-baby, I was taking it more for just mental clarity. Like I could just think better, think more quickly, and just, I was just sharper when I took fish oil. When I didn't, I just wasn't as sharp as quick by a very, very tiny, tiny bit. But now, post-baby, now that he sucked a lot of the fat out of my brain, thanks, buddy. The difference between taking it and not taking it for me is day and night, especially on days I work and I really have to use my head a lot. I do tons of math for my job. And if I don't take it, I can't add or subtract in my head, and I'm normally fine with mental math. So for me, it's the clarity. It gets rid of any kind of cloudiness. I can not just only perform better, again, more on task, more on target, with my thinking, think a little quicker, think on my feet, able to do videos like this where I'm having to think very much on the spot, hopefully not to have to do too much editing. There's that end, but a big added bonus has been memory for me. You know how when you're at work or you're out and about during the day and you're thinking, oh man, I need to do this thing or that thing when I get home? If I'm not taking my fish oil, even one day, I swear, I promise, one day, and I can't remember any of that stuff I thought about unless I go on my phone, write it down, or type it out and save a note. And when I am taking fish oil, I can usually remember those things. And yeah, that's okay. Yeah, maybe not a big deal, but when you're a busy mom working full time and trying to build a business on the side, that's really huge. Being able to remember anything after work without writing it down is miraculous. So for me, it's an overall clarity thing. I don't have problems with depression and anxiety, so I can't speak to that. But brain health, yes. In general, yeah, I can support that personally. Again, this is me. And again, there were, women I worked with at the prison that said, yep, the fish oil does nothing for me. This is dumb. But plenty of women said, yeah, this is actually, it doesn't quite do what my Prozac does, but it gets pretty dang close, So I have some links below of products that I looked into. I didn't just look at the label, looked into, make sure they're legit and their sourcing is good, because you can take 2,000 milligrams of this fish oil, 2,000 milligrams of this fish oil, and get 2 different results if they're one's crappy, I guess, and one isn't. It's just better made. So that's what I looked into for you. So yeah, if you want to give it a try, I absolutely recommend it. If you don't, that's okay too. So, and anytime you need to talk to your doctor and ask questions, please do. I absolutely recommend that for anything that I ever talk about on these videos. Yes, to kind of cover my butt too, but weird things can happen with things you don't even expect. So, all right, y'all have a fantastic holiday season, and I will see you after the holidays. Take care.